HHS asks clinicians, patients, developers, and health systems how the agency should guide the use of AI in healthcare delivery. That feedback will shape the department's approach to trust, interoperability, and responsible adoption. We'll talk through what happens next with Deputy National Coordinator for Policy at HHS, Mark Atalla. Mr. Atalla, it's nice to have you on the show this morning.
It's great to be here, Terry. Thanks so much for having me.
HHS just closed a major request for information asking the public how it thinks the department can accelerate the adoption and use of AI in clinical care. We've heard a lot about this in lots of different facets. What was the driving force for HHS in opening up this RFI to the public generally?
Thanks again, Terry. I'm happy to jump into the topic of the year and probably the decade, artificial intelligence. So first, we'll start. Last year, the Office of Management and Budget released guidance. And so for the policy nerds listening, OMB Memorandum 2521 on how agencies are empowered to drive AI innovation and seize the opportunity to apply the best of American AI, directing agencies to provide improved services to the public while still maintaining strong safeguards for civil rights, civil liberties, and privacy. And so that's a big ask and a big remit. Overall, OMB's guidance to agencies, including HHS, really was a unified structure for how we should be thinking about applying AI to the work that we do for the public in government. And so I think in that context, thinking about human flourishing, thinking about economic competitiveness and national security, while also still mitigating unlawful discrimination or other parts that just aren't great, and that's consistent with the AI in Government Act, we did two things. And so the first is we looked at, how is AI going to be used across HHS? And so we asked the question of how can we apply AI safely and intentionally to improve how we work and really provide the services that we do to the public. And so in December of last year, we issued the HHS AI strategy, which really was this culmination of these questions and how we wanted to answer those questions. So it was our first initiative for how the department should and can transform itself to make AI available across our federal workforce, integrating across internal operations, research, and the public health functions that we have. Really, this AI strategy fulfilled our commitment to make sure that we were actually being efficient for the public. We were utilizing technologies in ways that we want and ask other people to use those technologies. And so we wanted to make sure that we were thinking about them really in a fulsome way across what we do. And so with an eye towards fostering American innovation, improving patient outcomes, the Secretary's Make America Healthy Again objectives, and I think concretely, what that looks like is we rolled out 3 large language models, or LLMs, to our employees and to the teams. We see really great use. We look at that. We want to see what can be improved. We also look across what future technologies we should be thinking about now that people will be excited about over the coming years. And so that's really our first strategy on how are we thinking about AI inside of HHS. Moving to your actual question, which was, the driving force behind HHS broadly releasing an RFI focused on clinical use cases and adoption of AI, and then really the kind of voices we hope to hear from as part of releasing the RFI. So in parallel to looking at how we use AI internally at HHS, we really need to understand and want to understand how the area that we focus on, so the health and well-being of Americans, how is that going to be impacted by artificial intelligence? And so, I think you and I both know that, the technology is transformative. So from that world and from that vantage point, we wanted to release this RFI to hear from clinicians, technologists, patients, people, and broadly the general public to seek really concrete experience-based feedback from those that are buying, building, evaluating, using, and then receiving care from these AI tools that are novel, and then those that really want to receive care or use AI but can't. And so those barriers that they're faced with in terms of adoption, in terms of cost, in terms of trying to understand what role these tools will play in their general work. And so from that end, we really want to hear broadly across all of America to understand what we can do to help use AI safely but to its full potential.
A big focus of the way AI is getting deployed in the medical practice field is easing the burden on providers and improving the patient experience. So 2 areas where AI has a lot of potential, but potentially also a lot of risk if the tools aren't designed well. When HHS thinks about this kind of deployment, are there use cases or innovations that you think hold the most promise?
Yeah, no, that's a great question. I think if you look at the press release that went with our RFI, so we broadly believe AI will be a transformative force for good across America. It can improve patient and caregiver experiences, it can reduce costs, it can improve outcomes, reduce provider burden to what you said. And then I think broadly we think about the general healthcare trend, whether it's Medicare, whether it's Medicaid, and how that will improve affordability. So when we think about both access and affordability, those are key pillars that we've focused on. How can AI unlock benefits across the U.S.? And so I think to that end, we want to make sure that we're mindful that AI adoption is guided by real needs and experiences, which is the reason, in large part to us releasing the RFI. And so when we put out really our comments to say, how can we use AI to impact use cases, we thought about a few use cases that were relevant. So I think the two use cases we thought through first were and we see is first administrative use case. And so that's not the focus of what we thought about, but we do hear a lot from providers of how are they using AI and in their how they deliver care. So whether there's AI scribes where they're ambiently listening to what a conversation between a provider and a patient is, and then dictating that automatically inside of a prescriber's note, or other parts, around scheduling, around administrative functions, around billing and prior authorization. So we hear we're tracking those types of administrative use cases. I think truly how patients will think about and will use AI with their providers is think about a primary health approach. And so if I take it back, so think about a patient with diabetes or high blood pressure, they're over their ideal body weight. It is really hard to make behavior change. I think we've all tried, and we've all to some extent succeeded or wish we succeeded. And so the use of AI to support a person, whether that's directly through recipes, through encouragement, through the really hard work of behavior change, and providers want their patients to engage in that behavior change, but it is incredibly hard to scale the call from the provider, to the person daily when they're at a moment of weakness, et cetera. AI is actually really good at that. And so if I think about that use case of truly a behavior change and what the Secretary's objectives are around making America healthy again, AI, I think, has a ton of promise there. I think beyond that, we also have to think about specific populations. And so from that end, we think about maternal health. We think about where are there patients that are experiencing limitations in their activities of daily living as they age. We have an aging population, and thinking about how we're going to care for them is something that we do think about a ton. And I think with that, those are areas that we hope to see the positive impacts of AI. And then beyond that, the concept of accessibility technology. And so for patients with disabilities or people with disabilities, the ability of how to help disabilities become a thing of the past through AI and through technology is a fascinating idea that I truly hope we see the innovation in and continue to see people focus on those areas to help actually address the real use cases that people have that they're dealing with on a daily basis.
I'm speaking with Mark Atalla. He serves as both the Deputy Assistant Secretary for Technology Policy and Deputy National Coordinator for Policy at HHS. Mark, let's follow on with those kinds of use cases, because one of the challenges I think that comes up here is that data privacy and patient trust really are essential if you're going to deploy this kind of AI more broadly. How is HHS thinking about the balance between enabling data flows that are necessary to keep all of that back-end information flowing, but also maintaining strict privacy and security for patient trust?
Yeah, it's a great question, Terry. Thanks so much. So we use this phrase called data liquidity. And so if you think about data liquidity from our angle, it's one of our core objectives. And so what it really means for a person is, how can my data as a patient, how does it flow through the system? So how does it go from my provider to me? How does it go from provider to provider? And then thinking about how that then reduces duplication of care. So if my provider knows that I had something done at another provider, whether that's an image, whether it's labs, I don't need to have those same labs done again. And so in that vein, we have something that we refer to, and it's quite an acronym, called TEFCA. And so what TEFCA stands for is the Trusted Exchange Framework and Common Agreement. And so what that really is think about it as a network. It's a network of different types of providers that have come together. They're broadly interoperable through TEFCA. And when we say interoperable, it means that we're able to securely exchange and access data across different providers. And so provider A and provider B may be on totally different systems, but how do you make those systems interoperable is really what we focus on here at ASDP-ONC. And so from the TEFCA lens, the ability to scale connectivity nationwide is really through trust, meaning that we built into the CHEFCA network trust to say that provider A and provider B, or the patient that is seen at both places, really have established trust that Mark Atalla is Mark Atalla. And so from that, once you've established trust, it really allows then the automation so that there can be queries between providers and queries for myself to say that I'm only going to get Mark Atalla's data that is my own data. It's not another Mark Atalla that lives somewhere else. And so I think as we built that out and as we've used technology, I think that idea of trust, that idea of privacy and security, it really started from the beginning, and that has been our focus. I think beyond that, we really have tried to say, where can we foster standards and other data sets that in a world of AI, that security is paramount. And so, I think we'll see going forward, electronic health records, whether it's precision medicine, public health, how does that live in the world that we still maintain individual privacy and security without losing the benefits of the technology?
Mark, as we're speaking, the comment window has just closed, and I'm hoping you got hundreds of thousands of responses. I know you haven't had a chance to look at all of them yet. But as HHS goes through this process and considers the responses, what should stakeholders be expecting as you start shaping a more unified HHS response to AI in clinical care?
Yeah, it's a great question. So we definitely will receive a lot of public comments on this, and I'll acknowledge that we may or may not be able to respond individually to each, but we do consider all comments. And so I think what stakeholders will expect is this is a really meaningful RFI. And so when we put out an RFI, and that's a true request for information, is we need stakeholders' input. And so from that input, they should start to expect to see activities at the department and then also at agencies, so CMS, FDA, CDC, that reflect their feedback. And so I think as you see the themes, and all comments are public, as you see these themes emerge, our broader goal of helping improve the health and well-being of all Americans, and that's across all communities, large and small, we're working hard to make sure that changes to regulation, changes to reimbursement, and changes to research and development really do impact patients directly and how they receive care from their providers. And I think we can do that together. And so you should expect to see, broad change over the next years from feedback and as this technology advances.
I've been speaking with Mark Atalla. He serves as the Deputy Assistant Secretary for Technology Policy and the Deputy National Coordinator for Policy at HHS. Mark, I really appreciate you bringing this initiative to us, and we'll look forward to an update.
Thanks so much, Terry.
We'll post this interview at federalnewsnetwork.com/Federal Drive. Subscribe to the Federal Drive wherever you get your podcasts.